Hello everyone, today we will be discussing about the C factor. So C factor, what is C factor? C factor is a fraction which describes the relationship of bonded to unbonded surfaces of a restoration. So the higher the level of C factor is, the more severe the effect of polymerization shrinkage will be. So in simple words we can say the C factor basically describes how much or how what is the probability of the shrinkage which is going to be happening in a particular cavity design, in a particular situation we can say. So the shrinkage only happens when the two surfaces meet and we are trying to bound two surfaces with each other. So whenever we say that there will be shrinkage, then we have to be sure that of the number of of the number of surfaces which are bonded to that material. So for example, in a class 1 cavity, the cavity has 5 walls which has to be bonded with the material. So 5 walls are mesial or mesial, distal, buccal, lingual, and the floor of the bulb. So these are 5 walls which has to be covered with the material, and one wall which is the occlusal surface which is not bonded with, of course not bonded with any material. So it has one free part and 5 parts which are occupied with the material. So the shrinkage ratio will be 5:1 and the C factor will be 5. So highest amount of shrinkage can be seen in this particular cavity. As we go to the other classes, that is class 2, in class 2 there will be 4 bonded walls and 2 walls will be unbonded, that is mesial or distal and occlusal. These two walls will not be bonded with the has to be stick to the material because those walls are missing. So we have to build it with the material and do not have to give support to that wall. So definitely those wall will be free of the actual enamel. So that will make the ratio to C factor to 2, and the shrinkage will be lesser than the class 1. Similarly, for class 3, it will be the C factor will be 1 because the bonded and unbonded surfaces both will be 3 and 3. So the ratio will be 1. Then for the fourth class 4, the ratio will be 2:4. The bonded surfaces will be 2 and the unbonded will be 4. So the C factor declines further, which is 0.5. And for the class 5, it will be 0.2, and minimum shrinkage can be seen in this because the bonded surfaces will be only one, which is apical or pulpal, whatever you want to say, and unbonded surfaces will be buccal, occlusal, mesial, distal. All these will be the unbonded surfaces. So the shrinkage will be 0.2. C factor will be 0.2, and the minimum amount. If anybody asks what cavity design shows minimum amount of shrinkage, then it will be class 5. And what cavity design causes the maximum amount of shrinkage or the maximum amount of C factor, that is a cavity in class 1 cavity, and the C factor is 5.